Yes.
Alrighty, we'll go ahead and start off with the second presentation, which will be my presentation. I'm doing this with my colleague Chia. We'll go ahead and introduce ourselves real quick. First off, I'll just introduce myself. My name is Austin Corpus. I'm a fourth year medical student. I'm interested in pursuing internal medicine. I'm participating in this year's match cycle and with the intent of going to internal medicine, specifically with primary care. And alongside me is Chia. Chia, would you mind introducing yourself?
Hi, my name is Chia Meremetoh. I'm a fourth year medical student. I'm also in this match cycle as well. And I will be also applying internal and family. And yeah, I thought this was I think this is very exciting study that we did. So I'm excited to be presenting it with Austin here.
Perfect. Yeah, I think this is a very insightful research that we have done. And so I'll go ahead and get started. So the title of this presentation is a retrospective observational cohort study on Medicare patients in blood pressure control using RPM program in Middle Georgia. So essentially, we evaluated the effectiveness of remote patient monitoring for blood pressure control over a 90-day period. Oh, give me one second. So regarding the outline of this presentation, I'll go ahead and go over the background, which includes includes hypertension information and RPM. And my colleague Chia, she will go over our specific research. So in regards to the background, hypertension is the most common preventable risk factor for cardiovascular disease, CKD, and cognitive impairment, and is the leading single contributor to death and disability worldwide. So under the 2017 ACC/AHA guidelines, the prevalence of hypertension among US adults was 45.6%, and hypertensive medication was recommended for 36.2% of US adults. While at the same time, under the JNC7 guidelines, the prevalence of hypertension among US adults was 31.9%, and hypertensive medication was recommended for 34.3% of US adults. It is calculated that the estimated adjusted annual cost is $131 billion per year higher for hypertensive adult population compared with the non-hypertensive population in the United States. Those with hypertension had a higher lifetime risk of cardiovascular disease than those without high blood pressure and developed cardiovascular disease 5 years earlier. So in one study, the blood pressure lowering regimen reduced risk of major cardiovascular events by about a 6 per 5 millimeters of mercury reduction in systolic blood pressure in individuals with and without without reduced GFR. In another study, it is found that throughout middle and old age, blood pressure is strongly and directly related to vascular mortality. At ages 40 to 69 years, each difference in 20 millimeters of mercury in systolic blood pressure is associated with more than twofold difference in stroke death rates and with twofold difference in the death rates of ischemic heart disease and from other vascular causes. So digital technologies hold potential to improve healthcare quality and patient outcomes. The goal of RPM for blood pressure monitoring is to have constant monitoring to improve quality of life, improve compliance of regular BP checks and medication adherence, and to decrease incidence of cardiovascular events such as stroke or heart attack. RPM delivers continuous or periodic digital data to a central location, used to monitor patients between visits. These data typically are reviewed by clinical staff whose time is billed incident to the supervising physician. RPM can complement remote care delivered via telehealth. Well, in 2019, the Center of Medicare and Medicaid Service launched the RPM program that provided reimbursement for using technology to monitor patient between visits. RPM was expanded by Medicare/Medicaid to improve coverage and to reduce barriers to access. Early evidence supporting RPM use appears favorable. However, some have raised concerns that the potential for overuse of RPM without clinical benefit. So in 2019, the total amount of Medicare/Medicaid for RPM was 5.5 million. In 2020, the RPM payments increased almost ninefold to $41.5 million, followed by a further 2.5-fold increase in 2021, totaling to more than $101 million annually. Based on the national data from the Medicare program, RPM grew approximately 19-fold over 3 years, suggesting rapid uptake. And this is just a picture depicting how much exponentially we're increasing, Medicare is increasing for RPM program. So in one study evaluating the effects of RPM blood pressure monitoring, researchers conducted a prospective cohort pilot study to quantify patients who achieved blood pressure control of less than 140/90 at 90 days. Results showed patients with a non-inferior blood pressure control at 90 days had an average of decrease in 13.5 systolic blood pressure at 90 days, while experiencing a significant reduction in office-based visits at 90 days as compared to control. So how does that affect us for the patients in Georgia? So according to the CDC, in 2017, heart disease is the leading cause of death in Georgia. So this map shows that the concentration of counties with the highest stroke death rates are located primarily in the southeast region of the United States. That said, Houston County has one of the highest heart disease hospitalization rate per 1,000 Medicare beneficiaries in Georgia. So just to recap, hypertension is the most common cardiovascular risk factor. There are concerns about the potential for overuse of RPM without clinical benefit. According to the CDC, in 2017, heart disease is the leading cause of death in Georgia. So we analyzed the effectiveness of RPM on controlling blood pressure in a primary care office in Middle Georgia. We performed a retrospective observational cohort study. So this study quantifies blood pressure outcomes after 90 days of RPM monitoring. The setting is a primary care clinic in Southeast US located in the stroke belt. The population in the studies are Medicare patients ages 65 years old and older with hypertension. We use smart meter RPM device to track their blood pressure over time of a period of 90 days. We wanted to answer if RPM devices are beneficial for Medicare patients in Middle Georgia in lowering their blood pressure. We hope to gain insights in RPM service and provide data that this service is benefiting Medicare patients in Middle Georgia. So what are the parameters? Well, specifically, we looked at Medicare patients who were given RPM devices from January 2022 to March 2024. We looked at patients with initial blood pressure of greater than 140/90, in-office BP readings with and without hypertensive medication. We also looked at patients of initial blood pressure of less than 140/90 diagnosed with hypertension with and without hypertension medication. Patients were instructed on how to use the device at the start of the RPM monitoring. Medical staff were instructed to call patients to review blood pressure readings once per month. And office visits were scheduled if patients' blood pressure averaged above 140/90. The blood pressure treatment was adjusted based on the patient's blood pressure results. Patients must have at least 10 readings per month every 30 days. And after 90 days, we checked the most recent blood pressure measurement either on RPM device or in-office BP readings. And controlled was defined as less than 140/90.